Yeah, good evening, one and all. So there are few important things that we need to implement in the preparation. Okay, I don't know, like we have a very decent time for the preparation. Let it be your November INICET or let it be the upcoming NEET exam. Okay, so we have 10 months for the NEET exam. Okay, in and around like 10 months and 8 months for INICET. Okay, right. So very, very important. You have 10 months that turns around 300 days for your NEET golden exam. And I hope the screen is visible right now. And you have approximately 7 to 8 months of preparation time. Okay, that turns around like 210 to 230 days for your INICET, which will be in the month of November. I hope you are clear with these things. We have discussed so many times. I hope you guys are clear with these things. Okay, 10 months for your NEET and 7 to 8 months for your INICET. Clear? This is important, very important. And Telangana students are not eligible to November INICET, so they are directly going to give the NEET exam as the first exam. So you guys are going to take your first exam in the next 300 days. Okay, so let's consider NEET. Okay, let's consider NEET. That is 300 days. 300 days is a very, very good time for good preparation. And don't imagine that, okay, 300 days is a very good time so that I can leisurely start, or I want to go with a slow pace. I'll enjoy my internship. I'll take leaves whenever I want. I'll take breaks in the preparation, come back and I'll do it. Don't take these things granted. Those days are over. But after seeing NEET 2024, the recent examination, the questions were in the known areas, but it were tricky. Okay, so that requires more conceptual reading. You need to read more, understand more, practice more. So these are more required. So a simple 3 months, 4 months preparation, like I was talking to few of your seniors, PGs in the college are telling like 3 or 4 months preparation is sufficient to end up with a good rank. No, those days are over. So this 2024 paper is completely against to those 3 to 4 months of preparation and ending up a good rank. Okay, so you require more time and you require more conceptual reading. You require more time to practice the MCQs, revise the MCQs, revise the conceptual reading. And I hope you guys are very, very clear regarding this. Okay, so the most important thing is, yes, you need to be aggressive. You need to be aggressive, but make sure you're going in a right way. Okay, make sure you're going in a right way. So that is very, very important. So this is an alarm sign for each and every one of you. People who are targeting high. People who are targeting high. Okay, I don't know. Can I know? I think like 60, 70 odd students were there live. Good. Can I know how many of you really want to get in top 500 of all India? My question. How many of you want to really want to get into top 500? If you are top 500, you're going to get a government seat. So can I know the response? How many are really serious, want to get into top 500? Yes, I see so many people responding for this. Yeah, very good. Very good. Very good. Right. So now the next question is, yes, you have time. Okay. You have the time, which is sufficient for you to get into top list. Okay. So now you check it off. You have 300 days. 300 days is a very, very good time, extraordinary time. if you spend your time properly with books, if you spend your time properly with the content, practicing the content, following the checklists, finishing the tasks on time, giving exams on time. Okay, the most important thing in the entire checklist is giving exam on time. Okay, because I see people have a mindset of giving exam only once the syllabus is done. Okay, and is there anyone on the group? I hope like every one of you has finished the final BDS, right? Is there anyone on the group who has finished the entire syllabus and given the final year theory exam? Who has read everything for the Viva, everything top to bottom? Anyone? I'm not in this list. My preparation is always incomplete. Okay. Our preparation is based. So till the last exam that you have given, few of you are repeating their exam, maybe NEET MDS. Okay, let it be 2023 or 2024. But most of you, the last exam will be final BDS exam. Is it right? I have given my last exam as MDS final exam. Okay, right. Do you ask me my preparation is complete 100% from the time from my schooling till 11th and 12th and followed by BDS and MDS? In any of the exam, in hundreds of the exams I have given, my preparation is always incomplete. Always, never it is complete, never. Okay, the logic here is how many years you read, how much time you read, whatever you do, your preparation cannot be complete. Do you accept this? Do you accept this statement? Preparation is always incomplete. And I see students, like whenever I ask them, like, have we done with the recent exam? Have we done with this exam? They said like, I'm not done with the syllabus, sir. I'll try to finish the exam or give the exam after finishing the syllabus. Syllabus cannot be covered here. I am teaching from past 10 years. I'm teaching from past 10 years. Syllabus is incomplete. We cannot cover. Okay, it's very huge. Whenever you teach something, the question can come from other side. Whenever you teach something, yesterday some new invention will be there. Yesterday some new technique will come into existence. Yesterday some new equipment will come into existence. Yesterday a new disease will come into existence. New drug can come into existence. Question can come from that area. So syllabus is always incomplete. Okay, so make sure you give exams on time. This preparation is not syllabus based exam. Okay, your preparation, your prep is not syllabus based. It's not syllabus based. It is time based. What is time based? Means by next year, this time, I'm not sure whether your syllabus will be completed or not, but I'm 100% sure your exam will be completed and result will be outed. Are you clear with my statement? Do you accept with my statement? Next year, next year, by April, I'm not sure whether you're going to finish the syllabus. I'm not sure whether I will finish the syllabus. I'm not sure whether you're going to touch each and every MCQ on this website. I'm not sure you're going to watch each and every smart video on the website. But I'm very sure your exam will be done. Your result will be out. Okay. People who has worked in a better way, they get a better rank. People who are not up to mark, they feel bad and they may repeat. This is 100% is true. The point here is it is a time-based preparation, not a syllabus-based preparation. How much you read? Least bothered. How many times you read? Least bothered. What books you read? Least bothered. Which coaching center you are from? Least bothered. Whether you're an online student? Least bothered. Offline? Least bothered. Which plan you took? Least bothered. Most important is time. Next year, by this time, exam will be done, result will be out. So I request each and every one of you Conquer student with all the positive energy, whatever you have, okay, around you, taken from the mentors or some XYZ factors, make sure run with the time. Make sure do things with the time. Make sure try to cover the syllabus with the time. Trust me, even if you finish 60-70% of syllabus, you will be in the list. It's impossible. Even mentors cannot finish 100% of syllabus. Okay, if you finish 60-70% of the checklist, whatever I'm stressing out to do, you're done, you're in the list. So it's very simple. I want you guys to come into practical world. Practical world is something which is impossible for 100%. But Okay. Do you think the topper is going to cover the syllabus 100%? No. The topper is best among all of us. The ranker is best among all of us. Okay. Someone is getting rank 1. Someone is getting state rank 1. Someone is getting college best rank. Someone is getting the best rank among the batch. Okay. Means they are better than others. That's the only reference. Okay. The only reference is, yes, they are better than others. It doesn't mean they are ideal. It doesn't mean they have done everything 100%. Are you clear about this? This is very, very important. Okay. And I want you guys to be more aggressive. I don't know, like now we have 70, 80 odd. Okay. Let me have a poll. How many of you have given general surgery exam? How many are done with general surgery exam? Please. How many are done? 1, 2, 3, 4, 5. This is, yeah. You see, so few people are not responding. Guys, come out. Okay. No one is going to see your marks. Number one, no one is going to see your marks. No one is going to talk about your marks. Okay. Okay. The point here is the exam is going to give you a factor. Exam is going to give you a fear factor. Exam is going to tell you where you are at. Exam is going to tell you how far you have to run. Exam is going to tell you what are the modifications that you need to do in the preparation for a better outcome. Now I'm giving an open statement. People who give exams regularly, people who analyze the exams regularly, people who identify their mistakes, and people who work on their mistakes are going to be in the list finally. It's okay. You may have 6,000 MDS seats in the country. Okay, it's not a big deal. You see 25,000 students are going to give exam and you see 6,000 seats are there, means every fourth person is going to get a seat. We don't have a heavy brainstorming competition here. Okay, maybe you see like 1,000 or 2,000 students are going to prepare at their best, but most of the students, okay, most of the students, they fall in other category. Okay, so every fourth or every fifth student is going to get an MDS seat. Okay, it's not like 100 out of 1. It's not like 200 out of 1. Okay, every one of the 5 students is going to get a seat. So you're going to get a seat. Okay, that may be a government seat, that may be a private seat, that may be a deemed seat, that may be a state level seat, all India seat, so many seats. You may get a clinical, you may get a non-clinical. And again, in the clinical, you have so many departments, upper departments, lower departments, passion-oriented departments, non-clinicals, lots of things are there, lots of options. So don't worry about the options. Pakka, you will get a seat. When every fifth student is getting a seat, I hope like you guys will be in that 5 out of 1, not a deal. But now I want you to be more aggressive. Here we require more, like you should be more serious about your goals. Okay, more punctual about your goals. Don't find a reason for your inability. For example, like I was asking like one of the student, have you given exam? The student is going to tell like, I'm posted in endo department. Means preparing a reason. It sounds funny. The reason of not giving an exam is posted in endo department. Okay, do you accept this? Okay, so don't come out with the explanation for your failure or for your inability. Okay, make sure you try to keep some space, try to finish the exam, try to analyze the exam, then post your questions to the mentor, not subject-oriented questions. Sir, this is how I have prepared. This is what the marks I got. How can I improve? So this analysis is very, very important. Analyzing the question and understanding the concept. And whenever you see new questions from new areas, adding them to your preparation, moving ahead with a good positive mindset in the entire phase of the next 10 months is going to give you extraordinary ranks. Clear, right? Before analyzing the question paper. So these are the few things like, so let me, like now we have 75 to 80 students. I think like few students may see this in the recorded version if they're free. Okay, right? So I want a promise from all these 75 students. Okay, all these 75. My team is recording who are these 75 students live. Okay, so all these 75 students, give me one promise. From next time, whether you finish the syllabus completely or not, I want you to take the exams properly. Let it be a topic specific or let it be a subject specific. A promise from all of you. Are you in for this? Are you in all 70, 78? Let's take a vote because this is all for you. Who am I in this? I'm just a mentor. I'm just a guide who's going to guide you. Let's take the exam. Nothing wrong. Okay, nothing wrong. No one is going to hit you. No one is going to scold you. No one is going to make a comment on you. No one is going to pull your legs. Give exam. Give exam. It's on the website. Okay, I want every one of you to give exams, right? Okay, let's, I see a very good response. Thank you so much. Let's give exams. Let's give exams. Okay, let's give more exams. Let's read more content. Let's understand the content. Let's revise the content again and again and again and again. Okay, right? Okay, very good. Now coming to analysis. Now this time, as it's the first analysis, I don't want to talk about the marks and all these things. So I'm going to talk about the pattern of analysis. So let's consider the final exam. Okay, let's consider the final exam, not about general surgery. I'm talking about one exam. Let's consider your final exam. So final exam will be for 240 questions. Okay. So this is available in part A and part B. Part A will be for 100 MCQs. Part B will be for 140, total 240. And I hope you guys know this. Every right answer +4 and every wrong answer -1. And I hope you know this too. So now what is the point is, in this 240 questions, like I'm talking about the top 2,000 to 2,000. Let's consider they were top 1 to 2,000 creamy students. Means students who has a very decent round of reading. Okay. So in this top 2,000 students can able to answer 160 to 180 questions. Their zone, this is their zone. Their zone. Okay. If you go into top 500, top 200, the zone will decrease. Okay. The zone will decrease. For example, maybe the top 500 has ability to handle 180 to 200 questions. And it's not mandatory that all 200 out of 200 they attempted will go right. Okay, right? So their zone. So this is the zone they know. The top 2,000 people, they know a zone of 160 to 180 MCQs. Okay, for example, let's consider as 180 MCQs. So these people who are in the top 2,000, they don't know how many MCQs. They don't know 60 MCQs. They don't know. And these people who are in the top 500, they are acceptable to 200 MCQs, but they don't know 40 MCQs. Clear? Clear, clear, clear. I want your response. So in the second thing is, so this first fellow, 2,000 below fellows, they know 180 concepts out of 240. And 500 below people, they know around like 200 concepts out of 240. They know out of 200 concepts out of 240. Now the next thing comes is accuracy. Like you guys see regularly you're giving exams. Okay. Do you accept that even when you know a particular concept, you're going wrong? Do you accept this? You know a concept, but even then after reading the concept, because of lack of revision or because of confusion in the question or twist in the question or some XYZ factors, what is happening is you're going wrong even after knowing it. So that is how the people are going to differ. For example, I'm talking about one category that is 2,000 below. 2,000 below. So 2,000 below people are having access to 180 questions out of 240. Again, in this 2,000 below, you have 4 categories. Category 1 is 500 below. Category 2 is 1,000 below. Category 3 is 1,500 below. And category 4 is 2,000 below. What is difference? All these people, they know this 180 questions. They are good with this 180 concepts. But rank is varying. Why rank is varying? Because their accuracy in this 180 questions will be high for this 500 below students. Means, for example, the 500 below students have an accuracy of around like 160 plus or 160 to 170 plus in this 180 questions. And coming to category B, that is 1000 below, they are having a moderate. What is that moderate? Their range is 150 to 160 right answers. 1500 below, their range is 140 to 150 right answers. 2000 below, their range is 130 to 140 right answers. Clear? People know everything. Okay, these 2000 students, they know all these 180 questions, but their accuracy in attempting a question in a particular concept which they already know is high here, moderate here, and minimal and low here. Clear? Means your reading is fine. You and your friend reading the same content. When you give an exam, if I'm talking about a particular MCQs, you know, both of you know the same content, but your friend is going to get 5 marks extra and you're going to get 5 marks less. The reason of this 5 marks extra and 5 marks low is basically accuracy. How the accuracy? What are the reasons for that? What are the factors which are going to control the accuracy? Anyone? Any reasons you have observed in the accuracy in the last couple of months of your reading? Anyone reasons? It is revision. One important reason is revision. You revise the things again and again, again and again. Make sure even if you know, revise the things. The second one is give exams. Because exams are going to tell your weak points. You work on weak points, your marks will increase, your accuracy will increase. You do revision, your accuracy will increase. You are more serious about everything around you during the preparation phase, everything around you during reading. Okay, your accuracy will increase. Reading properly, question reading properly, reading the question properly in the examination hall. In the examination hall, reading the question properly in the examination hall, understanding the question properly in the examination hall will improve the accuracy. Means the 3 hours of your exam, you're more focused, your accuracy will increase. So these are the things which are going to make a difference between a ranker who is in the range of 1500 to 2000, who is in the range of 1000 to 1500, who is in the range of 500 to 1000, who is 500 below. All the students will have same IQ. Okay. And all the students will read the same content. Okay. But why the approach is going to different? Why there are few variations in their rankings is basically because they may be lagging in the revision. Few of you who got a higher rank may not be much focused on giving exams. Even they give exams, they don't analyze the exams. They give exams. Okay, that's all. Give the exam, submit it, see the answers, leave it. They don't analyze their weak points. They don't work on their weak points. They may not be very serious in the preparation. Ah, cool, Dimdas, sit. When one of your friend is calling for a movie, ah, chalo. That is your difference between 2 friends. Like one friend who is more serious, if a friend is calling for a movie, he's going to tell you, today I have a class. I have a pro-live class. I have to attend it. Maybe tomorrow we can plan for the movie. Or today I have a general surgery examination. Okay, we'll catch up for the movie for the second show. Okay, for the late night show, because I'll try to finish the exam in the evening session and I'll try to check out the answers. Evening, if late evening, if you plan for a movie, I can join. So these people, I'm not asking you to quit the plans. I'm asking you to be more serious about your goals. Okay, so you can clearly convey them to your friends. That is what seriousness. Seriousness is not something like quitting the preparation. Okay, keeping a serious facial expressions, sitting at a corner. Okay, reading always. That is not seriousness. Seriousness is making the priorities. You make a priority, which is more important. Watching a movie now before giving an exam or watching a movie after giving an exam. Okay, so you prepare your seriousness. Seriousness is not something like you're becoming a psychopath. I see like few students, seriousness is something like they want to become a psychopath. Okay, they don't want to talk with their friends. They don't want to interact with anyone. They don't want to enjoy. They don't want to go for a movie. Okay. They want to be serious. Okay. Shout on everyone. That is not seriousness. Seriousness is priorities. Okay. Keeping exam or keeping preparation as a first priority in the upcoming couple of days is the most important. I see, like last year, I see once the exam was thought to be on February 9th, and the exam was, just a second, and the exam was postponed to March 18th. And once I see my offline students, I see a day before the postponement, there are like 60, 70 students reading in the room. Once the exam is postponed by 30 days, I see no one in the room, like 5 people are reading in the room. That is not seriousness. Okay. That is not how you behave once the exam is postponed. You keep your priorities. Okay. So this is what the seriousness that what we really require. And performing your best in the examination hall is one of the important thing. Just a minute. I'm getting so many calls. I want to keep the mobile under silence. You got it right? You got it? What are my 4 factors? The 4 factors which are completely in your control. The 4 factors which are completely in your control is revision. Okay. Keep time for revision. Make sure every day, keep 10% of your time for revision. Okay. Gayatri, how many hours you are reading per day? Shravan, how many hours you are reading per day? Just a rough idea. It's not mandatory. Okay. How many hours you guys are reading? Shruti, how many hours you're reading here? Okay, right. Let it be. Okay, let's consider someone is selling. Let's consider it as 8 hours. 8 hours you're reading. Or let's consider it as 10 hours you're reading per day. So in 10 hours, keep 10% of time only for revision. Means, if you're reading 10 hours, keep 1 hour for revision every day. If you're reading 5 hours, keep 30 minutes for revision every day. Means every day, 30 minutes will be for revision. Like for example, now regularly a student is having a habit of sleeping at 10 o'clock or 11 o'clock in the night. Okay. Make sure the last 45 minutes or last half an hour is a solid revision. So whatever I have done from the morning, okay, for example, today I have done general pharmacology. So what are the important things in pharmacology? Okay, modes of administration are important. Okay, in which what are the important points which ma'am has discussed or which you have written? Click those points. Try to recollect those points. Whenever you're stuck at a particular point, just open your notes, see it and close your eyes and try to recollect the other points. Okay, now clinical trials are there. What are the phases? Phases 1, phase 2, phase 3, phase 4. What is happening? Adverse drug reactions are there. Zero order kinetics is there. First order kinetics is there. What are the drugs following zero order kinetics? Yeah, there is a one code. Okay, are you able to recollect it or not? If you're not able to recollect, open the book and see. Close it. Again, try to recollect. So this is how you have to do the revision. Okay, so every day, last half an hour or 45 minutes, you have to exclusively plan what you have done today. What you have done today, try to recollect it. And the last 10 minutes before you sleep, check out what is tomorrow's topic. Check out what is tomorrow's topic and what you need to do. What are the highlights of the topic? Okay, something like a trailer of tomorrow's movie. Tomorrow you have a movie of 8 hours or 6 hours. Now you should have a glance of that trailer for the last 10 to 15 minutes. Plan your day tomorrow before you sleep. So these are something which are going to make you more oriented towards your goal. Okay, next take the subject specific. Next, they take the topic specific, where you're losing an MCQ. You're losing an MCQ in an area which you're already exposed, or MCQ which is already exposed, or MCQ which you are not exposed. So identify them, mark them, okay? Add some good qualities, okay? So try to spend more quality of time with yourself. Then you will find out what is good and bad in you related to the preparation and personally too, okay? And make sure whenever you're giving an exam, let it be a topic specific, let it be a subject specific. You should be utmost focused. It is not something like you hear a volume of songs on one side and you give an exam on the other side. In the middle of the exam, your mother is going to call you to have dinner. You keep your exam aside, go finish your dinner and come back. This is not how we give exam. This is how your final exam is going to be done. People sit in supine, semi-supine position, give exam. This is how your final exam is going to be. No, every exam, let it be a topic specific, let it be a subject specific. That is your final exam. So if you follow the principles here, you can follow the same principles there. Okay. What is the mode of hearing a class? You sleep reclinely and hear a class on the bed. How do you hear the class? You watch smart videos, right? How do you watch a smart video? How I am sitting now? Are you able to see how I'm sitting now to take a class? How you have to sit when you're hearing a class? Chit-chatting with your mother on one side and hearing a class, right? Doing head massage on one side and hearing a class. There are few girls, last year I have seen, pro-life class, they kept their video on and mother is doing head massage for the girl and girl is hearing the class. Pharmacology, even if you keep utmost focus, let's take pharmacology, you keep utmost focus and you hear the class, you don't understand. Trust me, you don't understand pharmacology. Okay. Have you remember those days, like how you used to fight to tell the viva related to the cephalosporins classification? Have you remember cephalosporins classification? Nightmare for most of the dental students during second year pharmacology. Do you accept it? Pharmacology? So normally, if you hear the class only, you don't understand. You keep recline, sleeping position, under pillow. Okay, come on. Be serious. This is seriousness. Hearing the class in which you have to hear it, you can understand something. You can grasp something from the class. Okay. So that's what I'm telling. Like seriousness in the last 3 hours in the final exam will have a big impact on your life. How serious you are and how the things you are going to maintain now, you are going to extend the same things over there. Okay. So this is a big eye-opening, guys, to all of you. NEET 2024 is not in the zone where students take things granted. You have to be very serious about the 3 hours of the exam. Let it be the time management. Let it be how focused you are in those 3 hours has a bigger impact. Okay, right. So now I'll be talking about like how to, I told you, right, how to analyze the paper, analysis. So keep an extra one exclusive book for the analysis. So in this analysis, you try to make a table. So the table is going to tell you number of questions. Okay. For example, let it be a question number. Okay. Let it be like write down the entire analysis of a paper so that you can get the pattern. What is that? Question number 1 in surgery exam, for example, there is a question paper of 120 MCQs. So question number 1 is right answer for you. Okay. Is right answer for you. And question number 2 is right answer for you. Question number 3 is wrong. Okay, is wrong. Now you are analyzing why it is wrong. And I want you to drop in this particular box. Okay. So questions which are right questions. Questions which are right, but you are not clear. Sometimes you don't know the concept properly. You will be confused in the exam, but you keep something, it will be right. Clear? Questions which you know, which are right. Questions which are right, which you are not clear. Not clear. Third category, questions which are right, but you don't know anything. Here it is not clear. Option number 2, block number 2 is not clear. You know, okay, I know thyroglossal duct cyst, but whatever question that is given in the exam, I'm not clear, but it is right. Sometimes question which you don't know, the concept which you don't know, but by fluke or by luck, you kept right. So these are 3 categories of right questions. Okay. So what are 3 categories of right questions? Okay. You know you're right. It is right, but you are not clear. You are right, but you don't know the concept. Clear with these 3 categories of questions? So after every exam, you have to analyze the paper and write out how many questions fall under this category, how many questions fall under this category, how many questions fall under this category. Okay. Now, wrong answer categories. So wrong answer categories, again, you have 3 categories. Wrong and you don't know. Wrong and you're not clear. Wrong and you know everything about the question, everything about the thyroglossal duct cyst, but you went wrong. So you have 3 categories of questions with wrong answers, 3 categories of questions with right answers. So tell me, in these 6 categories, which 2 categories should be more for you? In these 6 categories, which 2 categories should be more for you after analysis? Which 2 categories? This category should be more. And this category should be more. Because, for example, in an exam, you are going wrong for a question which you don't know. Yes, it is good. It is good. It is accepted. Because you don't know the concept and you went wrong or you did not attempt it, that is okay. Because the ultimate goal of us to improve the accuracy, not to find out the answers of the questions which you don't know. Why you're bothering about the questions which you don't know? For example, you're giving a final year theory exam. Okay. So there are somewhere around like 20 questions. Okay. There are around 20 questions. You know answers for 18 questions. You'll be more worried to perform better in the 18 questions, or you're more worried to perform the 2 questions, which you don't know, which you want to create, which you want to find out. So my goal, I'm telling it's, let's focus on those 18. 18 will give you good rank. Perform that 18 well. And if you perform that 18 well and leave those last 2 questions, attempt them, the paper setter will be very comfortable. Like, super, this fellow is very good. Okay, attempted well. And slowly, in the last 2 questions, even if your performance is not well, is going to drop some extra marks for you. This is a simple logic that you have to follow, right? So for questions which are right and you know should be more, and questions which you don't know and you're wrong should be the next one. Okay. So questions which you are not clear, what may be the reason if you're not clear? You know the concept, but you're not clear. Here we require revision. Questions which you know, but you went wrong. Reason for that may be overconfidence. Maybe not reading the question properly, or not checking the options properly, or instead of like you, overconfidence will lead to, in the examination, your class 1 will become class 2, class 2 will become class 3. Category 2 will become category 3, category 3 will become, because you have overconfidence and you simply overlook the question and you forgot the question. Okay, right? Clear? Clear, right? So these 2 columns are very important. Not clear is basically due to revision. You're going wrong for a known question is basically due to overconfidence or not reading the question properly. So guys, from this exam, like probably once you're done with general surgery exam, go back, keep 6 columns. Okay. Make sure, drop how many questions fall under each category and try to analyze the question paper. And then we'll try to find out the ways to decrease your wrong answers and improve your right answers. This is the only analysis implementation I want you to follow for the next 5 examinations. After 5 examinations, we'll discuss few more techniques to improve your wrong answers and to increase your accuracy. I don't want you guys to end up with 2000 rank. I want you guys to end up with 500 below or 1000 below. The only mantra for a ranker of 2000, 2500 to get into 1000 below is what is that? Reading more books, right? That's what we do, right? We want more marks. We read more books. You read more content, join 2 coaching centers, get access to 2 more apps. A good methodology for a ranker of 2000 to 2500 to get into 500 below, 1000 below is revision. Read the same content again and again. Don't read the number of contents. Don't increase the number of books. Don't increase the materials. Here we require more accuracy because the number of questions 2000 ranker attempt will be same as the number of questions 500 ranker or 1000 ranker attempt. The only difference is, what is that? Number of right answers and number of wrong answers. 2000 wala fellow will have more wrong answers and less right answers when compared with the ranker 500 below. But you see the number of attempts of both 500 ranker as well as 2000 ranker are, what are they are? They are same. Okay, so please give exams, analyze the exams, understand where you're going wrong, and implement your skills and time in overcoming that particular fear factor, in overcoming that particular factor. Okay, so now I see today morning I got calls from few of you. Okay, sir, less marks. Can you tell me the names of other books what you have to read? So what you want to do? You want to read more books or you want to do more revision? Okay, let's focus on revision. Okay, so revision is important. So let's everyone focus on the revision. I will also try my best to revise the things, the same things again and again on the group. So let's work with the strategy and let's achieve our goals. Clear? Clear? Okay, right. Okay, so this is what I feel like I need to discuss with you today. The next one is, shall we have a brief outline of pharmacology? Are you ready? Okay, first and foremost thing about pharmacology. Okay, I'm just going to talk the outline of pharmacology. So pharmacology, according to many generations who are preparing for the NEET entrance examination or INICET entrance exam, this is the most difficult subject of all-time difficult subject. Even I see when I'm preparing 10 years back, I see many of my friends, including me, we have that a glance of phobia towards the pharmacology. So I accept this. Pharmacology is one of the toughest subject, and it will become more tough if you don't read it in a proper way. If you don't read it in a proper way, it is normally tough. If you don't read it in a proper way, it is going to be more tough. Okay, right. Now, outline of pharmacology. So NEET is going to carry 14 to 16 marks in pharmacology. And this pharmacology is covered everywhere. Every subject is going to have a pharmacology. For example, like you take, except probably your community, except community, everywhere you have pharmacology. For example, oral pathology, yes, you have infections, and infections treatment plan is pharmacology. Oral medicine, you have pharmacology. Okay, oral radiology. Sometimes oral radiology, they can give an inclined question. Like, for example, whenever the patient is going for radiotherapy, okay, so what are the drugs to be given or something, like they can interrelate, not radiology, oral radiology, radiation therapy related. Okay, such a questions can also come from pharmacology. Okay, right? You see oral surgery pharmacology, endo, they can ask pharmacology, because whenever you have endodontic infections, conditions which require NSAIDs, conditions which require like your antibiotics, or whenever, for example, like triple antibiotic paste is a pharmacology question. What are the drugs included in triple antibiotic paste is a pharmacology question. Conservative, yes, pharmacology question can. So pharmacology question can come from everywhere, and particularly when you're talking about OS and GS, okay, and general medicine, pharmacology questions will be high, integrated questions. For example, like your LAGA, local anesthesia, general anesthesia, are a part of pharmacology. Okay, right? And pharmacology can be system-wise again. GIT drugs, respiratory drugs, renal drugs, endocrinology-related drugs, CVS drugs, CNS drugs, ANS drugs. So it is a system-wise. Okay. So the main reason of planning to finish pharmacology ahead of many other subjects is this year, particularly this year, is we'll get more time for revision. And what I'm planning is, like, for example, once we are done with pharmacology, I'll try to add one topic of pharmacology revision along with every other subject. For example, for example, you're doing community dentistry. So I'm going to add 2 extra days for community dentistry and add CVS drugs. Or next subject, if I'm planning to do operative, I'll add 1 day and I'll try to add general pharmacology topic as a revision. So I want to do more revision and forceful revision of pharmacology with you along with the other subjects. So that is the primary reason why I want to start pharmacology now. Clear? Okay. Now what is the plan for pharmacology? For example, you're asking me checklist of pharmacology. Let's don't jump into 100 books. Let's keep one book, simple book. What is that book? Sparsh Gupta. Stick on to Sparsh Gupta and make sure don't go very deep into all the topics. Okay. There are few topics which you have to go deep. Okay. What is that? The topics which I have given more time. Okay. I hope you have seen the schedule. Which topics I have given more time? Hope you have seen the schedule, right? Which topics I have given more time? Yes, I have given more time to chemotherapy. Yes. What are the other topics which I have given more time? The other topics which I have given more time is general pharmacology. You have seen like some topics which are given only 1 day. Those topics, you don't need to go very deep. Okay. You stick on to smart video, followed by try to solve as many MCQs as possible from Sparsh Gupta. Okay. Reading synopsis in Sparsh Gupta will take more time. So I want you to read synopsis. Okay. So topics which I have given more time is chemotherapy, general pharmacology. The other important topics are LA and GA. But LA and GA, I want you to cover like basing upon the convenience. I want either you can cover these things along with the present subject, or you can cover these things along with oral surgery or general surgery. Okay. So we'll try to plan and we'll try to do it, because oral surgery anyway, you have covered your LA. So now we'll try to cover GA. Or if you're not done with LA during your oral surgery, you can plan now. So the main important topics, the major topics are chemotherapy, general pharmacology, LA and GA. Okay, the next comes for a dentist, emergency drugs. Emergency drugs. And the last important is drug interactions. Dental drug interactions, dentist-oriented drug interactions. These are the major topics of pharmacology. For these topics, it's good as much as you do. For example, like I'm going to give the checklist of these 5 topics. Okay. Chemotherapy, I want you guys to focus more on smart videos. If possible, try to read synopsis of Sparsh Gupta for topics like penicillin, cephalosporins, tetracyclines, most of the antibiotics. Okay, most of the antibiotics and antiviral. Okay, for these 2 topics, it's good if you read synopsis, even if it is okay, because the most important questions where 90% of the questions are coming from, they are covered in the smart videos. Okay, but if you have time, it's better you read for these topics. One is antibiotics, second one is antiviral. Okay, right? Clear. Okay, the next one is once you're done with this, so you can come for the evening activity on the WhatsApp. Okay, try to attend it and take the topic specific exam. And if you're done with this particular sequence, repeat this sequence again and again. No need to do anything extra. Again and again. Oh yeah, make sure you're done with as many MCQs as possible in Sparsh Gupta. And you see there are more MCQs, but the point here is the MCQs will be overlapped. Means same MCQ will be given again and again. Okay. Okay. So you see one drug of choice question will be repeated 4 or 5 times. I hope like people who have solved it, they'll get to know. Don't see the bulk of the book. You see, you try to practice it. So once you feel the questions are overlapped, okay, make sure you try to strike it off. I don't know like how many of you are doing on hard copy and how many of you are doing on soft copy, but make sure overlapped questions, please do strike it off. Questions which are unique, please do mark them. So those unique questions you are going to revise again and again. Those striking off questions you are not going to repeat again and again. Clear? Smart video is going to give you the basement, what is required. 90% of the questions. And this is going to be the practice. Okay, same goes. Next one, general pharmacology, same. The checklist is same. Clear? LAGA, LAGA, LA, for example, LA, smart videos. Smart videos will be in the folder of oral surgery. I want you to focus on LAGA part of dental pulse MCQs. Here you need to do the dental pulse MCQs. Okay. Similarly, I want you to read LA synopsis of dental pulse in your oral surgery synopsis. MCQs, if time permit, you can do from oral surgery, because oral surgery LA MCQs will not be on the, it contains both pharmacology based LA MCQs as well as clinical LA MCQs. That is, they're going to talk about what is PSA, all your blocks and everything, whatever A to Z they're going to cover. Okay. So you plan accordingly. If you have time, yes, it's good. You go back, cover them. If you don't have time, you can stick on to the synopsis of dental pulse, which is very good pharmacology based synopsis, which will be covered in your oral surgery. Then evening activity. Okay. Then the topic specific exam. This is for LA. Clear? But coming to GA. GA, same as pharmacology. Chemotherapy, how you have done chemotherapy. GA, no pulse. Okay, stick on to the pharmacology part. You try to check out the video first, try to finish the video first. So once you're done with the video, please try to check out the synopsis of Sparsh Gupta, then try to solve the MCQs of Sparsh Gupta, evening activity, and take the topic specific exam. Then comes the emergency drugs. Emergency drugs will be a part of medical emergencies. Okay. What is the medical emergency drug that is given in the case of asthma for a patient on a dental chair? Hypoglycemic shock, what to be done? Hyperglycemic shock, what to be done? Okay. There is an anaphylactic shock for a patient due to allergy of LA. What drug has to be given? How much doses has to be given? Which route it has to be given? So it is emergency drugs are preferably the medical emergency related drugs of choice or normal drugs of choice. You can plan accordingly, which I'll be updating you on the group. Okay. And similarly, drug interactions. You have a 6 to 7 pages of textbook based notes. Okay. Directly a few pics from the textbook taken from medical emergencies of Malamed. Okay. All the drug interactions that a dentist has to know. This is available as a smart notes in oral surgery folder. Clear? These are the 5 important, very, very important must-do topics and their checklists of pharmacology for an MDS CONQUER student exclusively. Because you have access to few content, refined content, you can follow this. Now the next one is you have the other topics, like what is the other topics? GIT drugs, CVS drugs, CNS drugs, ANS drugs, renal drugs, and endocrinology. Endocrinology is going to talk about diabetic drugs, thyroid drugs, anti-thyroid drugs, all this stuff. So in this miscellaneous topics, you have COVID drugs, you have skeletal muscle relaxants, lots of things, lots of opioids, NSAIDs. NSAIDs is very, very important. Okay, NSAIDs, I want you guys to add NSAIDs also to the major topic, because one of the most commonly used drug in dentistry, right? NSAIDs also, please try to add into the main topic and try to do the same methodology how we have done for the other, the major topics of pharmacology. Now coming to GIT. GIT and all these things like CVS, CNS, ANS, and all these things, I want you to follow the same checklist. What is the checklist? First is smart video.